Welcome to the Field Engineer. Today we are speaking with Millicent Alooh. She is the Regional Director for Biomedical Engineering. Welcome, Millicent. So to get straight into it, I was wondering if you could tell us a little bit about your early career, why you made some of the choices you did, and how you made it to where you are now.
Yeah, thank you so much, Charlie. Yeah, so Millicent, as Charlie has said, the Regional Director for Biomedical Engineering, working with the Rice360 for Global Health and Technologies, implementing NEST 360 program. So just getting to your question, Charlie. So in my early career, I was really driven by bringing change in the health service delivery, especially in low and middle income countries. And being brought up and born in Kenya, I would see a lot of struggles with people accessing health in different ways. So I was driven by really pursuing this career to be able to bring quality and bring some change in terms of quality healthcare delivery. And so I started off as a biomedical engineer with a focus on hospital equipment, where I would do this boy work. I would fix up the broken devices and just repair, maintain, and ensure that I train users on the various usage of devices, just ensuring full utilization of the devices that are available at the facilities. And so over time, I realized that there was a strong need for leadership in health technology management. And so I ventured into the leadership with my basic knowledge on maintenance of the devices. I figured out that we have very good skills on maintaining, but then there was a gap on leadership. And so I ventured on there, and whereby I was leading different biomedical engineering departments at the hospital level, and also decided to lead the Association of Medical Engineering of Kenya, an organization I felt would really also drive a lot of change when it comes to management of medical devices. And that has actually really made me to transition into different roles, like where I am right now in influencing policies at different levels, national and global, especially with my work at NEST 360. And so I want to believe that with that particular kind of drive, we still really have a long way to go as biomedical engineering professionals to be able to implement quite a lot within the vicinity. Yeah, thank you.
Excellent, excellent. So can I ask, who were the people who had most influence on your career, and were there any pivotal moments for you that made you choose any particular direction?
Yeah, great. So I have quite a lot of mentors. That is one question that really is very difficult to answer, especially for me, because I have mentors across my career. Like I have, professional mentors. I have people who've mentored me during my education, just to let me know, what you need to do this to pass, biomedical engineering course. And so I have had different mentors and looking at various people who have actually really excelled in biomedical engineering field. People like Tom Judd, the people who founded the Global Clinical Engineering Alliance. They've been very instrumental in really spreading the gospel of having effective medical device management. And so those are some of the areas that have actually made me. Those are some of the people that have actually made me really drive through my career. And one of the pivotal moments, I think, is the moment I joined the Association of Medical Engineering Leadership. Uh, that is when I realized that we have people in biomedical engineering who still don't understand what their career is. And so that for me was a game changer. And that drove my intention to really empower the biomedical engineers by really giving them a lot of knowledge on advocating for them to understand their roles well, and also just ensuring that they're also effective and impactful at the facilities where they work. And so for me, that was a very high pivotal moment for me. And even recently, when I joined Nest 360, and then I started interacting with the global community, I still realized, oh, we still really a long way to go, especially the biomedical engineers who are in low and middle income countries. And so I would say those two roles have actually really been pivotal moment for me. Yeah.
Okay, excellent. So I know you spend a lot of time traveling. I know trying to schedule some time with you has been a little difficult to accommodate for your travel schedule. How do you manage working on the move and across different time zones? Because that's a difficult task, right?
Yeah, that is true. It's actually it's a difficult task, but then it's enjoyable if you're really passionate about what you do. So for me, I think number one, despite the challenge that is brought about by traveling in different time zones, I really have a passion on what I do, and that actually really drives my motive and drives my work in all the spheres. And so, number one thing that really keeps me going is time management. I've come to realize that time management is very essential. And
Mhm.
so, it really with proper time management, I'm able to really like prioritize my work and leverage like in between the times when I don't have a flight, in between the flights, I leverage on those particular timings, and in between the meetings, I leverage on those particular timings to be able to just work and still move across zones. At times, you will find me in a meeting at the airport, and I know a number of people do that. Earlier on, I couldn't understand why somebody would be traveling and still having earphones and sitting down and having a meeting. But now I understand that really every little opportunity and every little time really counts. So you'll find me scheduling time in between flights, and you'll be like, "Oh, how did you schedule this time?" And you have, yeah. So I do that a lot because I know time is a very scarce resource, and so with my travels and time zones, I really have to use every little opportunity that I get to do what I want. You'll find me really thinking of so many things when I'm at the airport and coming up with very good schedules. And you'll be shocked at what happens when you have such kind of moments. Yeah. So
Yeah.
that is how I've been able to manage. Yeah.
Yeah, yeah. I can say from my experience that time when I'm actually on a flight is great time
Yeah.
to catch up and get things done. Or and you know that you're not going to be disturbed by a phone call or something someone coming in to
Yeah.
interrupt you.
Yeah.
So yeah, okay.
Yeah.
The next
Yeah.
thing I want to explore with you is around relationships. How do you develop the relationships you need to be successful, particularly in your current role?
Yeah, yeah, that is true. So relationship Charlie is very important in our daily lives, uh, starting all the way from the family life, career life, and all the way community and all that. So for me, one thing that I really believe in is with mutual respect and trust, relationship can be built. So I engage with various stakeholders in my current career, from government officials to, my peers, my supervisors, my seniors, and all that. But I really invest in time to understand their priorities with a lot of trust and mutual respect, and ensuring that I really align my goals towards what the priorities of my relationships are. And so with that kind of alignment and just ensuring that you understand what your stakeholders priorities are, then I'm able to actually develop build a lot of relationships across. And so this actually has really enabled me to network across the globe, and also just with continuous communication, just showing up with a lot of authenticity and genuine desire, to see improvements in healthcare system has actually really supported me
Mhm.
in doing a lot of things that I'm doing and in building the relationship. Yeah.
Okay. And then moving on, so what advantages do you think come from having diverse teams of engineers, biomedical engineers, or any kind of diversity in a team?
Great question, Charlie. There, diverse team is important, and there are quite a number of advantages that come from diverse team. Number one, and I've kept mentioning over and over that I come from I would say resource limited country, and so having diverse kind of teams will make you really understand what the needs and the desires of various communities are, and so you're actually able to understand different backgrounds, and people are actually able to bring in different insights from different communities. And the other thing that really having diverse teams of engineers is it encourages a lot of inclusivity and accessibility. You know, the moment even me being included in this particular leadership team, in terms of the biomedical engineering global leadership, it really encourages my team, my people who follow me, for example, really feel included when they see I'm part of the team. And so having that diverse encourages inclusivity, accessibility. A number of people now understand how to access some diverse, healthcare needs, probably through me because they've seen me, I'm in the space. And the same happens to people all over, like people in very poor communities. They're able to access one of their own because they know one of their own is in a particular space. So having diverse, engineers really encourage a lot of diversity, inclusivity, and yeah, and also with that you also get a lot of innovative, solutions that come about with diverse team, as opposed to just having one line. With diverse team, there's a lot of um, perspectives that come in, with a lot of innovative solutions that come in. And so I think there are quite a number of advantages of having a diverse team of engineers. Yeah,
Mm.
and just to mention gender, I know I'm passionate about supporting and empowering women. And so this is one thing that I like mentioning. And so when we talk about diverse team, I also mean including women in the group. And so
Absolutely.
whenever women are there, you can be sure of growth. From the Bible days, whenever we had women there, it was always associated to growth and multiplication. So multiplication, this is something that is replicated across all the aspects of life, even professionally. When I bring women leadership in the professional associations, I see very big multiplication as compared to our other gender. They're also doing equally well, but I can say there's a substantial and very impactful multiplication when it comes to women leadership. Yeah.
Mhm. Yeah, I think it's really important. We see, particularly field engineering, it's in terms of diversity, women aren't very well represented, and I'm really grateful and thankful for you for doing this interview. As a woman in a leadership position, I think that's really important to just to show that to the world, and make sure that we're being inclusive, and making sure that people can see what they can become. So I think that's really important. Um,
Mm.
Moving on to speaking about improving health technology in Africa. I know that's something you're passionate about. Can I ask what you consider the most pressing issues to making improvements in access to health technology in Africa? What do you think are the main issues you're facing right now?
Oh, good, Charlie. So we have quite a lot of pressing issues, but probably I'll just narrow down to maybe two or three. So one of the most pressing issues is lack of access to essential medical equipment, especially in the rural areas. You realize that most facilities are using outdated, you know, um, devices or technology, and the maintenance of this particular devices or equipment is a very big challenge, or rather is a major challenge across these facilities. And so people are unable to access medical equipment to support their healthcare needs because of that, especially in rural areas. And that is really major here. The other thing that I would also maybe is a big pressing issue is the shortage of trained biomedical engineers who can actually be able to maybe design and maintain these medical devices in these particular healthcare settings. I know we have a number of biomedical engineers right now. It's an exciting news that a number of training institutions are now training biomedical engineers. But the knowledge that we are getting, especially in Africa, is really limited to probably just maintenance of the devices that have already been designed. But we have a very big gap on the knowledge of the people who are actually able to design and just ensure that they design and maintain. And so this is still a very big gap. And even in as much as we have a number of institutions, training the biomedical engineers, we still don't have these biomedical engineers employed in various healthcare facilities. And I think this is a very big problem, especially in the government facilities, where they haven't really understood the role of biomedical engineers at the facilities. And so you will find one biomedical engineer supporting a 250-bed hospital. It's unbelievable, but that is really what is happening. So they can really do much. And so the critical shortage is there at the facilities level, not because the biomeds are not there, but because biomeds are not being employed. And that's why I keep saying that we really need to understand for biomedical engineers so that the government can be able to absorb them at various facilities to support. And maybe one final thing is on the policy and regulatory framework. Biomedical engineer being one of the profession in healthcare is still really underdeveloped in terms of policy and regulatory framework. And so you realize that a number of countries in Africa do not have really proper, or rather, they don't have regulatory framework for the biomedical engineering professionals.
Mhm.
And so they finish, they don't have any standard guideline to support their practice. And so it's very difficult to grow in such kind of environment. And so let me narrow down to those three as really the major pressing issues as of now, but we have quite a lot that we can work on just to improve in Africa as a team of biomedical professionals.
Mhm.
Yeah,
Okay.
yeah.
And it's something we touched on earlier, but I'm going to come back to the question of gender imbalance in engineering. How do you think more women can be encouraged to work in engineering?
That's a good one. And that's one of my passion. One of the things that I can quickly just point out is investing in mentorship programs for women. People don't know. Like I would say, I didn't even know what biomedical engineering is when I was growing up. And so ideally, we need really to have a lot of mentorship programs running to educate or rather to enlighten these women to be able to pursue, biomedical engineering and even to be encouraged to work in biomedical engineering sectors. Those ones who are pursuing biomedical engineering are left alone. They finish, they come to the field, they find a field that is dominated by male figures and they shy away, they chicken out. And so they leave very few women, to be in the field. And so it's a continuous, cycle. So one of the things that I would really um, emphasize on is investing in mentorship programs for both women who are pursuing biomedical engineering, those who want to pursue biomedical engineering, and just ensuring that we help support their passion in engineering and create maybe just better work environments for these people. Because I remember maybe just one quick one. When I got employed at a facility, one of the facilities, and I went and I was told where I was going to sit, and it was like a junkyard, but I had like about over 15 men working there, but they were comfortable. Like they didn't seem to bother about the kind of junk that was there with the devices and all that. So when I asked my boss, so where will I sit? And then he said, yeah, you will sit in the medical device workshop. But if you're not comfortable, then you can come and sit up where we sit. But I was like, no, but I need to make this a better environment for everyone else to work in. That's exactly what I did. So, but you see, that is me. Somebody else will say, you know what, that job, I don't think I can take that job if I'm going to sit in such a place. So we really need to create very good environment for these women to work because the biomedical engineering, like any other engineer, is a traditionally male-dominated field, and so we need to support women to really carry on and keep in the field. Yeah.
Yeah. Okay.
Yeah. Yeah. Yeah.
Okay. A slightly odd one for you, but if you could time travel and go back to meet your 21-year-old self, what advice would you give to her?
Oh, wow, wow. My 21-year-old, and I would say I would seek out for mentors. I think the mentoring thing has really gotten into me because I'm mentoring quite a number of girls right now.
Mm-hmm.
And so for me, my 21-year-old, I would really seek out mentors as early as I can and take advantage of every learning opportunity from them.
Mm-hmm.
Because I think I didn't do that, but somehow I'm here. I really struggled. I was swimming in a very big ocean. I really swam. I think I'm a very good swimmer in this ocean of medical engineering without a coach, Yeah, so seeking out mentors early enough and taking advantage of every learning opportunity is one thing that I can do. But the other thing that I can also do as my 21-year-old me, I would really be I would stay curious and never probably be afraid of taking risk. I would be a risk taker and take risk where the path is never straightforward always, and with a lot of resilience and clear vision, I believe everything is possible. So for me, I would not shy away from being curious and just taking risk whenever possible and whenever necessary, and so that yeah, everything is possible. That's what I would do
Mm-hmm.
with my 21-year-old self.
Excellent. Excellent. And
Yeah.
finally,
Yeah.
is there any more advice that you give to young engineers who may be watching this and just starting out in their careers?
Mm, I think one thing that I would give to the engineers is continuous learning and improvement of skills is very important for everyone. We are so lucky we are living in this age where information is everywhere. Whatever information you want, it is there. It's everywhere.
Yeah.
So for me, for anybody like who really, really want to grow continuously, learning is inevitable for them, especially in the field of engineering, which is really very dynamic. You really need to stay updated and updated with the latest technology and advancement. So it's very important to continuously understand what's going on, continuously learn, continuously network, and just continuously ensuring that you take advantage of available opportunities. And one thing that I will also urge the young upcoming engineers is not to shy away from taking leadership responsibilities. Even as I finish, leadership responsibilities are very key, especially for those who really want to bring change, because you can only bring change when you're on the table. If you're not sitting on the table, you will not eat. And so only the people who are seated on the table are able to actually eat well. So all of us sitting on the table are very important. And so do not shy away from taking leadership responsibility. And one final thing, just to remember, engineering is not just like about giving technical solutions, but engineering is about people and improving lives. And so once we get to know that engineering is about people and improving lives, we'll strive to do more and more to better the lives of people. I think that's what I can say.
Brilliant. Millicent, thank you so much for your time. I've really enjoyed our conversation. It's been really enlightening, so thank you very much.
Thank you. Thank
If
you
you would
so
like to
much.
see if you would like to see any more from the Field Engineer, please do consider hitting the subscribe button below and hit the bell for all notifications. Thanks very much.